Hello friends, my name is Dr. Gaurav Dixit. I am heading Department of Hematology and Bone Marrow Transplant in Artemis Hospital, Gurgaon. My department deals with blood cancers, bone marrow transplant and CAR T-cell therapy. Today we will talk about a very important topic which is called as bone marrow transplant. So first we will talk about what exactly is bone marrow transplant. Bone marrow transplant is a medical procedure in which we replace a diseased bone marrow by a normal bone marrow. It can be broadly of two types. First type is allogenic transplant, in which we replace patient's bone marrow by healthy bone marrow from a donor. So it requires a donor. Second type of transplant is autologous transplant, in which patient himself is the donor and patient is the recipient. So there are fixed indications in which we are doing allogenic transplant, and there are other indications in which we offer autologous transplant. So first we will talk about allogenic transplant, and there are basically further of three types. First is matched sibling transplant, in which patient's sister or brother is the donor. We always prefer full match donor because that gives us best results. Second type of allogenic transplant is called as half match or haploidentical transplant. So in which we take half match donors as the donors for the transplant, because all patients they don't have full match donor. So if patient doesn't have donor, we are left with half match donor, or we have to search for donors from the registry, which is called as matched unrelated donor transplant. So these are the three broad types of transplant, depending upon the type of donor. And we always prefer to do full match, whether it is from the family or it is from the registry. Now talking about the indication of allogenic transplant. There are two types of disease in blood. One type is the cancer. It includes blood cancers like ALL, AML, MDS, and basically transplant is done at all the stages in AML. And most of the patients who have AML or acute myeloid leukemia, they require bone marrow transplant. If we do it earlier, results are better. If we do it at later stage, results are not so optimal, but still sometimes we have to do it. Other indications like ALL, acute lymphoblastic leukemia, is also treated with allogenic transplant. Usually, ALL is a very good cancer in the sense that it responds well to chemotherapy. However, patients who are not responding to chemotherapy, they require BMT. Then there are other cancers like MDS or lymphomas, then myelomas, who require allogenic transplant in few cases. The second part of blood disease is a non-cancerous disease, which includes sickle cell disease, which includes thalassemia. And bone marrow transplant is the only way to cure sickle cell disease and thalassemia as of now. Going forward, we may have more therapies like gene therapies and other therapies, but as of now, bone marrow transplant is the only way to cure. And what we do is we take a good donor, we transmit those cells in the patient and replace marrow by a normal marrow. So these are the indications and the types of allogenic bone marrow transplant. In case you have any other queries or you want to ask any questions, please feel free to contact CureIndia. Thank you.
If you are interested in treatment in India, please subscribe to our channel and press the bell icon to never miss a new video from us.